As NEET PG is over and you have got your ranks, so this is the time that you should decide which branch you should choose and which college you are going to take place. So branch video is already there. You can go check it in the I button. And this video is on the top colleges branch wise. Okay, so I am Dr. Mayukh Hazra and I am pursuing first year dermatology residency at Medical College and Hospital, Kolkata. So what is the importance of choosing the right college? First and the foremost thing is that तुम्हें वहाँ पे 3 साल बिताना पड़ेगा. So you have to choose a perfect college with your rank, with your ranking aspect, so that you can spend the next 3 years of your life with ease. ठीक है, ज़्यादा झमेला ना हो and it should be comfortable, because I have shared with you once the stats that about 1200 PGTs have left their course in between in last 5 years. So the leaving rate is very much high. So you should choose a perfect college for you, not just the top college, but select a perfect college for you. Okay, and number 2 point is that every college and every hospital varies with certain aspects, is the stipend, the bond, the location, the department, and the network you are going to establish. Everything matters. Okay, everything matters, every point matters, and you deserve to get to the best college with your desired rank. Okay, so for that, if you want to know that which college you can get, then to know the branch you can get with your rank and which college you can get, so do check the website neetadvantage.com. that is NEET ka advantage. Now there you can get access to the seat matrix. When the seat matrix of the NEET PG 2024 would be released, it would be uploaded there. You would get the seat matrix with all the colleges. You can also see the stipend also, and the bond living penalty. Okay, every information at a place. You can get the closing rank, the branch quota. Okay, here you can fill up any data which rank you are going to see, what is the closing rank, which rank range, do you have any category wise also you can see, you are coming from which state, you can give it there. And main thing is that you would get the latest updates at a place, and it also has the choice organizers with which you can plan your choices ahead of time and use it as a reference while filling up choices. And what you can get at your rank also, you can search in the range and you would get the medical colleges, and after that make an informed decision. I would tell you about that in the end. So complete subscription is at just rupees 999, जो कि लगभग 1/3 प्राइस का है और दूसरे कंपटीटर ऐप के साथ. So link is in the description box below and also in the pinned comment section. Now first branch that we are going to talk is about the top branch, that is radiology. So according to ranking, first comes is the VMMC, and here we have kept the bond, modality, intervention radiology, whether it is present or not, and the academics. Okay, so VMMC has all the modalities, USG, CT, MRI, and it has intervention radiology, so it is taken by the toppers. Okay, within AIR 10 it is closed. After that people prefer MAMC, and it doesn't have intervention radiology, but you get the scope of SRship there, and the academics is also good. After that people take is RML, then is LHMC, and then another hospital. If you are coming from Mumbai, then I know that मुंबई के लोग मुंबई छोड़ के जाना नहीं चाहते हैं, क्योंकि उन लोगों के वहाँ पे अच्छा हॉस्पिटल भी होता है and only 1 year का बॉन्ड रहता है, and Mumbai is Mumbai, much better than Delhi as a city. So KEM hospital you can choose. All the last year toppers choose KEM hospital only, those who are from Mumbai. So it has all the modalities, it has intervention radiology also, and it has good academics. Now coming to West Bengal aspect, those who are from West Bengal or going to choose colleges from West Bengal, these are the top 3 colleges. That is IPGMR, it is the best. Here intervention radiology little bit is performed, but not that much profound, I would say. After that is MCK, Medical College and Hospital, Kolkata, or sometimes it is mentioned Government Medical College and Hospital, Kolkata, and NRS. Okay, So this is the radiology part. Now after that, coming to dermatology. Now still some are having confusion whether to choose radiology or whether to choose dermatology. So basic funda is, if you like clinics, OPD basis clinics, go for dermatology, or else go for radiology. This is the basic funda, means in short. And dermatology has dermatopathology, it has surgery, a little bit of surgery, and medicine. It is an amalgamation of everything, and it is more dependent on the visual memory. So if your visual memory is good, then you can go for dermatology. और एक गोस किसी लोगों को लगेगा, शायद ये सिली क्वेश्चन है, मेरे को पूछा था कि does becoming a dermatologist you need to have good looks? No, you don't need to have good looks, but हाँ थोड़ा सा मेंटेनेंस तो चाहिए, क्योंकि अगर तुम गंजे हो गए, इफ़ यू आर बाल्ड एंड you are treating patients for who are complaining of hair loss, that patients would think अरे इनका ही ठीक नहीं हुआ तो फिर ये मेरा बाल गिरना कैसे रोक सकता है. सो कॉस्मेटोलॉजी पार्ट में थोड़ा सा लुक्स, मतलब थोड़ा सा मेंटेनेंस मैटर करता है. स्किन एंड हेयर यहाँ पे थोड़ा सा मैटर करता है. क्यों मैटर करता है? क्योंकि मैं तुमको और एक दो एग्जांपल देता हूँ कि आदिवासी हेयर ऑयल इतना लोग क्यों खरीद रहे हैं, क्योंकि वो लोग देख रहे हैं कि उनके पास इतना घना घना बाल है, इसीलिए आदिवासी हेयर ऑयल का सेल हो रहा है. अनदर एग्जाम्पल is that Kolkata's top dermatologist also underwent hair transplant recently. So that has an impact, right? So that's why he's undergoing the procedure. So a little bit looks matter in particularly cosmetology. Okay. So coming to dermatology, this subject, top colleges, I have first-hand experience, so I can explain very well. So first is VMMC. It is the top college. Just after MS Delhi it comes. It has 2 lasers, diode and NDAG laser. It has good surgery units. The department is great and the academics is great. And in Delhi colleges, the hands-on would be average compared to the West Bengal colleges, because there 3 years SRship is there, means 3 years SR are there, and there the SR can't practice outside the college. So the hands-on is more focused on the SRs rather than the PGDs. Okay, so hands-on is a bit average there. And bond तो नहीं है दिल्ली में, ये तो पता ही है. After that comes the UCMS before MAMC, because the academics there is better and HOD is influential. Influential meaning that if you are going for a case presentation or a paper publication, he could provide support. और मीन्स कोई भी कॉन्फ्रेंस में जा रहे हो तो फिर तुमको ये वाले HOD के स्टूडेंट हो ऐसे करके जानेंगे तुमको, ठीक है. सो थोड़ा सा HOD इन्फ्लुएंशियल होगा तो थोड़ा सा एडवांटेज है तुम्हारा CV के लिए ड्यूरिंग PG शिफ्ट. आफ्टर दैट इट डजंट मैटर एट ऑल. After that comes Maulana Azad Medical College. It is also not having any laser. Academics is more or less good. LHMC, it is also average. MAMC and LHMC more or less are same. PGT numbers are I think 1 less in LHMC, and academics here is also good. I think IDVL president is HOD of LHMC only. After that comes RML. The hands-on is less, very less. Hands-on is very much less. It is mostly focused on SRs, and laser is present, but they are only for the SRs. Okay. And academics is more or less good, but from the perspective I got from the seniors, that some faculty is a bit toxic, so people keep RML in the bottom, though previous year it was kept first, but according to the research I did, I found that RML is at 5th place among Delhi colleges. After that is another college, IMS BHU. So it has also good hands-on. Hair transplant is performed, which is pretty shocking. In our college, 1 hair transplant was performed, but in that our SR senior had brought the machine. We don't have the machine in the college, but there is a bit of excess patient load, and academics is good there. In IMS BHU, academics is good, but the patient load is a bit excess. In Delhi colleges, you would have about 100 to 110 hours of duty. Okay, IMS BHU, it is a bit less, 90 hours per week approximately. It may vary, because there you have 24 hours on call system, and in the Delhi there is dermatology emergency also, so you have to handle the emergency cases also. In IMS BHU it is not there. But the basic thing is that if you are going to take dermatology, if you settle in the cities, it is beneficial because the exposure you get is massive. I'm giving you example that dermatology is very much dependent on the medical representatives, and they organize workshops from the top dermatologists of the area or the city you are living in. Like you would have workshops of Botox, fillers and all. सो अगर ऐसा कोई सिटी में सेटल करोगे लाइक रांची, जहाँ पे कि ये सब नहीं होता है, या फिर शायद भुवनेश्वर में भी ये सब बहुत ही कम होता है, स्किन क्लिनिक ऐसा कुछ नहीं है, तो वहाँ पे ये सब का हैंड्स ऑन नहीं मिलेगा. सो बेटर टू सेटल इन अ सिटी. सो दिस ऑल कॉलेजेस आई हैव केप्ट अबव IMS BHU, और एल्स VMMC UCMS के बाद ही IMS BHU का अगर इंफ्रास्ट्रक्चर देखेंगे तो वह शायद VMMC के बाद ही आता है. But as it is not in a city, I have kept it a bit below. After that is KEM. If you are from Mumbai, no need to go for Delhi. KEM is a top dermatology hospital, and top dermatologists of India come from KEM only. So their 1-year bond is there, hands-on is good, and good instruments are there, and academics is also very good. So if you are from Mumbai, go for KEM. And there are 2 other hospitals. I don't have that much research and info about them. That is GMC Chandigarh and PGIMS Rohtak. Their bond is not there, so I have mentioned them. In West Bengal, there are not top 1, top 3 colleges. According to your priority, you choose the one. Okay, so in MCK academics is more, Arjigar academics is good. CNMC there is not much academics. Procedure, number of procedures that are performed and the type of procedures in MCK, the load is more, the patient load is more. In CNMC and Arjigar it is moderate. Lasers, Arjigar has all 3 lasers which are not present even in VMMC. Okay, so NDAC diode and CO2 laser is present in Arjigar, and one new laser has come in CNMC, but I don't know what laser actually it is. And in MCK, NDAC laser is present. IPL was there, but now it is non-functional. So duty hours, if you talk about, then it is 9 to 2 in MCK. After that, 2 to 4 is a class. Okay, so everyday classes are there. So as I mentioned that in MCK the academics is much more, so everyday classes take place. In CNMC there is not much academics, so 9 to 2 is the duty. In Arjigar it is 9 to 6 is the duty, and some emergency duties also you have to do. So the duty hours is a bit more in Arjigar. PGT number is more in MCK, so it is a advantage. And influence, as I said, that influence of HOD matters in certain presentations, or if you go in any conference. So Arjigar is on the top. If you consider MCK, our HOD sir is graduated from JIPMER, but he doesn't go to conferences, so he is not that much influential. CNMC HOD sir is also influential. After that, you keep in choice number 2 is NRS. It has CO2 laser, but the department is a bit old. अगर डिपार्टमेंट का बात करोगे तो देखने में सबसे अच्छा MCK का ही है. IPA JMR I have kept much below. If you see the cutoff, it is in the top, but I have kept much below because I know the situation. There is no AC, and it is a closed room with no AC, the department, and it is very much small. And HOD sir who was present, means who was a good influential HOD sir, he has retired in last year December only. So I had got the informations, and I have never kept SSKM as an option. Okay, so to take decision by doing observationship and having the knowledge. Okay, I am giving you the first hand knowledge of West Bengal and all India colleges. After that is tropical medicine, tropical school of medicine. After that is Bakura Sammelani. After that is Bardhaman. Okay, so this is the sequence. Medicine, I can tell you the rankings, but detail about academics, that much I don't know. So in medicine, RML you should keep first. RML and MAMC both are top, But RML, why you should keep first? Because there are 49 PGTs, so the workload is a bit less, okay, compared to the MAMC. और अभी शायद इंटर्न्स आ भी जाएंगे नेक्स्ट ईयर से, सो तुमको इंटर्न्स भी मिल जाएगा. एंड मैमसी देयर आर ओनली 25 PGTs. सो पर यूनिट का देखोगे ना, तो फिर यहाँ पे आ जाता है 4 PGTs, एंड इन RML देयर आर 8 PGTs. सो द वर्क इज डिवाइडेड, एंड RML इज इन द कनॉट प्लेस, इट इज़ इन द पॉश एरिया. सो वहाँ पे पेशेंट्स ना कम आने का चांसेस है. एंड मैमसी इज़ मोर क्लोजर टू द दिल्ली रेलवे स्टेशन, तो दूर से पेशेंट आने का चांसेस ज़्यादा है. एंड पेशेंट लोड मैमसी में ज़्यादा है RML से. सो थोड़ा सा लोड अगर कम होगा, यू कैन मोर फोकस ऑन एकेडमिक्स. सो RML को शायद ऊपर रखना चाहिए, दो मैमसी का फर्स्ट में ख़त्म होता है, बट आई वुड रिकमेंड टू कीप RML. एंड और एक को बात है कि मेडिसिन में यूनिट वाइज देयर इज डिफरेंस, ओके. तो तुम्हारा कौन सा यूनिट पड़ता है वो ज़्यादा इंपॉर्टेंट है कॉलेज से ज़्यादा. सो दैट इज़ ऑल्सो अ मैटर ऑफ फैक्ट, एंड यू डोंट हैव कंट्रोल ओवर दैट. आफ्टर दैट कम्स, you can keep VMMC above, it would be reversed, okay. VMMC above, after that would be LHMC. VMMC, one disadvantage is that the workload is very much high because the patient admission is about 70 to 80 per day, okay. Admissions are there क्योंकि वो एम्स के जस्ट ऑपोजिट है, एम्स दिल्ली के. सो VMMC इज समटाइम्स रिगार्डेड एज द डंपिंग ग्राउंड ऑफ एम्स दिल्ली. सो वहाँ पे पेशेंट लोड्स थोड़ा सा हाई होता है, इसीलिए ये थर्ड में जाता है. आफ्टर दैट इज LHMC, आफ्टर दैट इज UCMS, एंड इन दिस PGIMS रोहतक इज ऑल्सो वेरी मच गुड. और वन सीनियर डिड got rank 1 in NEET SS. After that, GMCH Chandigarh also you can keep in all India. And in Mumbai aspect, if you say Lokmanya Tilak comes first, then is ZGS, both have 1 year bond, okay. So only 1 year bond, it is not much of headache. West Bengal, as you know, 3 years of bond. So first in West Bengal is IPGMR, after that is MCK. You can choose MCK above also, because if you here rank based unit allocation is given, and our HOD sir, medicine HOD sir, has come from IPGMR only, and he has developed the department much more, and academics is more than IPGMR now in MCK. So if you get in HOD sir's unit with a good rank, it is more likely that he would take you in his unit if you are having a great rank. So if you are in his unit, then it is better than IPGMR. But for other units, IPGMR is better, and IPGMR is much more cleaner hospital, I would say, and super specialty blocks are more developed. So IPGMR come first and MCK comes second. After that is NRS, after that is RGKar, after that is CNMC, after that is BMC, Burdwan Medical College. There also admissions are very much high, about 80 to 100 admissions per day sometimes. After that is North Bengal Medical College if you are from the north of West Bengal, and if you are from south or near Kolkata, then go for Midnapur Medical College. After that is Sagar Dattam, okay. So general rules to choose a medical college is that if there is option of no bond, my mistake, okay, so no bond is preferred over a bond, obviously. But one advantage of the bond is that you get the job security, and with bond in West Bengal you can practice also. So it is seen that SRs of West Bengal earn about 3 LPM compared to the Central Institute, where it is, after cutting the taxes, it is about 1.2 LPM. So one difference is there, one advantage is there, but you don't have the control that where your posting would go after 1 year of SRC. So it is a bit unpredictable, I would say, and if you ask me, I would always go for no bond. And number 2 point is that you should give priority your region, means in the region you are going to settle, you should give priority over the outside medical colleges, okay. Because your network is your net worth, because the network you establish. And if you go to Delhi, obviously if you are for medicine, go for a non-bond stream because you have to do the super specialty. But in cases if there is a bond, if you are going to Mumbai from Kolkata, then the network you would establish in those 4 years with 3 years of PG and 1 year of SRship and you come back to Kolkata, all the networks are going to get destroyed. Okay, and in many cases the medical representatives do help in setting up your private practice. So वहाँ पे जो कनेक्शंस होगा, तुमको यहाँ पे लौट के फिर से कनेक्शंस बनाने में और भी 1 से 2 साल तो लग ही जाएगा. So in that case, if you want to practice in your region, do pursue from your region only, because there you would get द नेटवर्किंग बेटर, एंड नेटवर्क बेटर होगा तो फिर तुम्हारा फ्यूचर का प्रैक्टिस भी बेटर होगा और जल्दी एस्टेब्लिश हो पाओगे उस वाला प्रैक्टिस में. ओके, सो दैट वाज अ जनरल रूल. एंड अदर जनरल रूल बिफोर चूजिंग अ कॉलेज व्हाट यू शुड डू इज दैट यू हैव टू चूज व्हाट सूट्स यू द बेस्ट. सिलेक्शन कर लो ब्रांच का. अगर ब्रांच का वीडियो नहीं देखे हो तो फिर एंड में फिर से दिखाएगा, एंड स्क्रीन में, तो उसको जाके देख लेना. नाउ चेक व्हाट यू कैन गेट. यू कैन यूज द नीट एडवांटेज website for that to check which all colleges you are going to get, and you can select 10 colleges like that. Now what is the next step is that you should talk to the seniors of the college. Okay, at least first year and at least one SR of the college. बात करो उनसे कि कितना आवर्स ड्यूटी है, कैसा एक्सपोजर है. अगर एक से ज़्यादा लोगों के साथ बात कर सकते हो तो फिर और भी अच्छा है. ठीक है, उन लोगों से बात करो कि मतलब कैसा है जाने के पहले. उसके बाद क्या करना पड़ेगा, जब तुम मोर और लेस 2 और 3 कॉलेजेस में सिलेक्ट कर चुके हो, देन यू डू एन ऑब्जर्वेशनशिप. ठीक है, वहाँ पे जाके ऑब्जर्वेशनशिप मीन्स यू गो एंड डू द वर्क. ओके, वहाँ पे काम करके देखो तुमको कैसा लग रहा है, वहाँ के एनवायरनमेंट कैसा है, क्या सीनियर्स टॉक्सिक है, क्या उन लोगों के बीच में रिलेशन अच्छा है. ये सब तुम लोगों को तभी पता चलेगा इफ़ यू डू ऑब्जर्वेशनशिप. You would get to know about the environment. Okay, this was one mistake I didn't do and I didn't get the scope. So मेरे को मैम सी छोड़ के फिर से यहाँ पे आना पड़ा because the situations didn't suited me. मतलब वो वाला वीडियो है, तुम लोग शायद देखी भी हो. नॉट द टॉक्सिसिटी बट वहाँ का रीजन का या फिर वर्क कल्चर मेरे को सूट नहीं किया था. सो ऑब्जर्वेशनशिप इज़ वेरी वेरी इंपॉर्टेंट. टॉक टू सीनियर्स, then you go for an observationship and then you make a decision. Okay, and decision से फिर से पीछे मत हटना उसके बाद. and if you follow this 4 steps ना, then your chances of leaving the seat becomes very much less it is. So I think the video was helpful and this was actually part 1. Okay, if you want the next part, we aim for 500 likes. तो 500 लाइक चाहिए नेक्स्ट पार्ट के लिए. सो डू शेयर दिस वीडियो so that we can reach the target. Okay, share it with your friends, those who are sitting for counseling, and also do check out the neetvantage.com website. It is at a very affordable price and know what you can get at your rank. Okay, so all the best, take care, bye bye.